Okay guys, this is my video for the lower extremity portion of my palpation assessment. We're going to be looking at 3 muscles of the lower extremity and assessing their tone, temperature, texture, and tenderness. The 3 muscles are going to be tibialis posterior, peroneus longus, and flexor digitorum brevis. So these are all in the lower compartment of the leg here. I'll just start off by doing flexor digitorum brevis on myself because I know this is a pretty pokey and uncomfortable muscle to palpate. Bless you. So to find the flexor digitorum brevis, it's actually deep in the sole of the foot. So there's a lot of fascia and connective tissue and other stuff going on over here. So it's kind of hard to feel. But its main action is to flex digits 2 to 4 of the toes. It originates in the calcaneus here and goes into middle phalanges of the 2nd through the 5th digits. And like I said, flexes the toes. So to activate that, I'm going to pull my toes up and I'm trying to flex the toes there. And then you should be able to feel the muscle pop up into here, and the muscle direction goes distally down from the calcaneus into the digits this way. So I'm feeling that, and release, and then it does feel pretty tender for me. There is a lot of tone naturally. It's really hard to feel this muscle because there is a lot going on there, and I've had the heater on, so it's pretty hot down here. So that's the flexor digitorum brevis. The next muscle we're going to be doing is the peroneus longus. So the peroneus longus could be found in the lateral compartment here of the leg, and it's responsible for eversion of the foot, and as well as assisting in plantar flexion of the foot. So plantar and eversion. It originates on the medial surface of the shaft of the fibula, and it the muscle fibers trail down inferiorly, into the medial cuneiforms. And to activate it, we're going to be obviously just doing the opposite action. So I'm just going to tilt your foot slightly this way, and I'm going to be pushing you up and in this way. So just kind of pushing, and you're just going to try to bring your foot down and out, okay? So go for it. Okay, and then that just pops up right into there. That line, you can relax. You can feel that there. That's the middle of the muscle belly right there. There is a lot of tone, and I'm going cross fiber with my palpation all the way down. And you'll have your gastrocs and your soleus just around here. So you don't want, I know I'm on the muscle there because it not only does it pop out, but you kind of have a general guideline where the gastroc starts. So the tone is pretty high. The texture feels normal. Is that tender for you a little bit? No?
No.
Okay. So that's peroneus longus, or other known as fibularis longus. Our last muscle we're going to be palpating here in the lower extremity region is the tibialis posterior. This is a key stabilizing muscle of the lower extremity. It's found very deep, so it's in the interosseous membrane between the fibula and the tibia right here, so basically in between the shin, and it runs the whole length, going down, the muscle fibers going downwards into the navicular and medial cuneiforms. So about there, and it's responsible for inversion, so bringing the foot this way, inversion, and plantar flexion. Plantar flexion and inversion of the foot, and it's a key stabilizer. So to activate the muscle, we're going to be doing the opposite action, but it's really hard to palpate this muscle because there's a lot of musculature, like the gastrocs here, and the soleus underneath. So I'm going to kind of go down where I just kind of have the soleus here, and I have the leg extended. And what I'm going to do is just try to pull you downwards and inwards. Sorry, it should be a little. So just try to pull your foot up and out. Okay, so go for it. So pull. Try to bring. Sorry. Yeah, I'm gonna try to. You're bringing down some plantar flexion. So I'm gonna bring you down this way, and you're gonna resist that motion. Okay, so go for it. And I'm just gonna feel underneath here. Just kind of behind the calcaneus here, this little portion here, because I'm not going to really feel that muscle through here, like the Achilles tendon here. Then you kind of have the soleus back here. So it's kind of hard to feel that muscle, but it does feel pretty like there's increased tone here. And I'm going cross fiber. The fiber direction goes down this way. The temperature seems to be okay. The texture seems to be okay. And I can probably see on your facial expressions that it is a little tender for you there. So that's that muscle. Okay, guys, thanks for listening. Have a great evening.